Hello and welcome to Slice of Piefer. I'm Dr. Piefer here with the one and only Taylor Camouflage Scrubs Hayden.
It's not camouflaged.
She's camouflaging herself as if she was at an Olive Garden.
Where they treat you like family?
Not the restaurant,
thanks.
an actual garden of olives.
I think it would stand out like a sore thumb
Really?
in a grove of olives.
I don't know. I don't know how much standing that a sore thumb really does.
You would be the expert.
Neither of my thumbs are sore at all.
That's good. Glad for you.
Yeah.
Yay for you.
Even with some pretty tough work. We had some hard times.
It's so hard.
So difficult.
So challenging.
It's been a couple of weeks. And I can tell that you missed me.
I do miss you.
Not the pod.
Correct.
Taylor, you're breaking the pod's heart.
I don't think the pod cares.
The pod has a heart.
He's going to come out with like shirts that say podcast cares.
I heart pod. The podcast loves you. Yes, the podcast is like, hey, what's going on? It sent me a message.
I would be sitting here charting and all of a sudden the microphone would just...
Right. It has a little mind of its own. It's like,
talk to me. There.
Just rests on your shoulder and watches your computer.
Yes. The classic. Looking over the shoulder. Do you mind if I just...
You've got really large hands. How does that go for you?
Oh man, now we're really on a tangent here that doesn't make any sense for the podcast.
Well, someone asked me if I had what I thought about my really large hands. And I said, I've lived with them my whole life, so I don't really think about them.
Yeah. Do they help you be a better surgeon?
They do help me be a better surgeon.
But I can get into the back of the knee a lot easier than you can with my tiny hands.
That's true.
So
very true. Very true.
Pluses
There's
and
some
minuses.
value there. Pluses and minuses.
Pros and cons.
Yep. Big hands, big gloves. That's what they say.
Small hands, small gloves.
There you go. All good. Well, what have we done since we were back here? I went to Canada. You've been back and forth from Disney, and we've talked about that twice, but it's still kind of fun.
Yeah. Disney and then just rocking and rolling.
And Victoria, or whatever it is.
Seadrift.
Same difference.
Didn't even set foot in the city of Victoria the last few times I've been down there. Not that there's anything wrong with the great city of Victoria. It's just not on my way. It's not the way I take to get down there.
So you're sending love out to the Victorians?
Oh, yeah.
Taylor loves you.
I do.
She misses you.
I do miss the people of Victoria. I liked those. I liked the people I worked with. I liked the patients. I mean, that felt like my community. So, yeah.
Right.
I
They
loved
were your peeps.
Yeah, absolutely. And we get a fair amount of people from Victoria who come see us up here, which is pretty cool.
They travel a long way.
Yes, they do. I've made that drive. I know it's not short.
Yeah. We've had some fun and interesting on-call experiences. Me specifically. Yesterday was a bit of a wild one.
Yeah.
Late night, operating on emergencies. So that was fun. Yeah. Pretty bad knee injury and a pretty bad ankle injury.
Yeah.
So
Well, and again, just for like perspective on that, I think sometimes people are under like the guise that like when you're on call, that you're literally just sitting there at the hospital, like waiting to like take care of those emergencies and things as they come in.
correct.
But that's not the way that most people run practices.
Just watching the World Cup
Right.
reruns.
Right. Most people still have to have like clinic and surgeries and other like elective things in order, because it's too financially, doesn't make sense to just, oh no, are you getting called?
Negative. Fortunately, I thought I was. There was a number I didn't recognize, which sometimes means, hey, we need you to take a look at this X-ray.
Right. Well, anywho, back to my rant on this, because it happens sometimes where patients are like, why did I have to wait 3 hours or something like that to see the orthopedic surgeon when it wasn't something that was like an emergent, you have to get there in 30 minutes, like an open fracture or something like that.
Correct.
Like the standard ankle fracture, for example, that's closed, reduced by the ER. And, why wasn't he there right then so he could operate on it right now? I've never worked anywhere where that's how it worked, where they literally paid the on-call specialty doctor enough money that they could just sit there parked at the hospital waiting to do it, unless you're, again, talking about like a level 1 downtown residence. Like
right, you got residents who are just sitting around. That's part of their call. But also, in a given day, they may have 10, 12, 15 consults. And so,
Right.
if those take 30 minutes apiece, then you are working on doing that all day, and you got to have somebody who's dedicated to doing that.
Mm-hmm.
But in private practice, that's not really the way it works. And so,
Right.
so you get to have total knee, shoulder scope, total knee,
Mm-hmm. Yeah.
trashed ankle,
Yeah.
and then trash can knee.
Yeah.
It was great.
Good times.
One of the most, actually probably one of the most challenging days of call for me that I've had in a while, just in terms of just complexity of the cases.
Mm-hmm.
The ones for today were hip fractures. And so that was, pretty bread and butter for what we do all the time here. It's just, we have a hip fracture service. Those guys see 1 to sometimes 7 or 8 hip fractures a day. We're taking care of all of those guys. But yeah, and we see trauma, but the big heavy trauma, with the very highly complex injuries, not as. I usually also have my traumatology friends who I can just say, hey, here you go.
Yeah. Enjoy
Have a nice
this.
day. And they are available, but these needed to go a little bit more urgently. And that's our job when we're on call. So we got to take them. So
Yeah.
all good. Well, what do we got to talk about today?
So I have on the list that we were going to talk about the informed consent rule. When I say that, does that just
That makes me wonder about uninformed consent.
right? Well, just
I've consented without knowing what I'm consenting to.
correct. There are
It's like
times.
Taylor coming on the podcast.
Yeah, exactly. Not consented.
You consented. You just weren't informed.
I was.
Taylor, do you want to do something? Yes.
I don't think I said yes. I think I said no.
Okay.
I think actually we have video evidence of me saying no over and over that there's not going to be a podcast because I'm not doing this.
And look at you now.
Yeah.
You're wearing olive scrubs.
I
drinking
showed up to my
Alani.
clinic in my office and there was a podcast studio set up.
Yeah, that's how things happen in uninformed consent.
Exactly. So when we talk about informed consent, what does that mean?
So that means, informed consent is important, right? That's the beginning of, not the beginning of the relationship, but the beginning of the understanding of what the surgeon's going to do, right? And so you can't really operate or do anything invasive to a patient without them having informed consent. And so there is a difference between being informed and not being informed, and consenting to do something without understanding the risks and the benefits. That's what makes it informed consent. So we talk about the risks, the benefits, the plan, what we're going to plan to do. And then also within that is oftentimes kind of the disclaimer, like, hey, if we find something that needs to be fixed, we're going to fix it because you're going to be asleep during that time. So
that's that in all indicated procedures.
Right. And,
of
that relies on a bit of the, not a bit, but it just relies on the surgeon to do the things that are indicated. But for the most
surgeon
part,
to do the right thing and the patient to trust the surgeon.
Correct. You have to have trust. And I think without informed consent, it's difficult to have trust, right? You've got to be, as a leader, as a surgeon, you've got to be able to establish that relationship. And you have to be able to do it in a way that's quick, in a way that's efficient, in a way that is thorough, but also allows for you to continue to move forward, because you can't spend 7 hours, giving everybody every possible outcome of what could happen. But by the same token, you've got to be able to walk away. And I think a lot of that comes from experience. It comes from your own experience. It comes from your ability to establish a relationship and your ability to establish trust, where people can say, okay, I believe that this person's going to do the right thing for me.
Right. And so when we talk about informed consent, we're thinking about it in the nature of a surgical environment, that on any patient that's going to go to the operating room, they have to sign a consent form that says that they have been informed of the risks, benefits, and alternatives to surgery. They have elected to proceed with surgery with this surgeon. And so we're talking about a document, right, that shows communication happen, right?
See?
Communication
Yes.
between...
That was Spanish.
Thank you for translating.
Gracias.
De nada. So what that document shows us is that a pattern of communication happened, right, between the surgeon and the patient. And there's often advocates and people that are involved in that process. Nursing staff at the hospital commonly. Anesthesia is part of communicating informed consent, not just for the surgery, but for any indicated procedures from them.
Yes.
And undergoing, a general anesthesia, getting a regional block, anything like that.
Right.
And so I think what the informed consent rule we're kind of talking about really is focusing on is a pattern of good communication.
Agreed.
And that can translate not just to the relationship between the surgeon and the patient, but also the surgeon and his surgical team. And as well as other members that take care of patients, but also in business. And
Sure.
So we're talking a little bit about how communication affects the flow of things like that
Right.
today.
And I think communication, I agree with you. And I agree with the idea that, so informed consent is a process. It's not a piece of paper. Right. And so there's an informed consent form.
Yeah.
Right. And so anybody can sign that. And I've been in those scenarios where you're scrolling through, pages and pages and pages of documents when you're trying to get a cell phone or something. And, who knows what
you're
all
signing
parts of your
onto.
life you signed your life away. But the reality is you're about to let somebody, do something to your body while you're unconscious. And so it's the form is documentation of the consent, but the consent is a process of communication. It's a process of communication, establishing trust, and then establishing understanding, because the last thing you want to do as a leader is have either your team or have your patients or clients go into a process and then say, hey, I didn't know this is not what I signed up for, right? And this isn't where I want to be. And so I think that part is important in that, just in the process of that communication, for sure.
Yeah, for sure. So talking about communication, not just with like patients, but with like your surgical team, do you ever have a process like before surgery, maybe before difficult cases or something that's out of typical, where you have a conversation or communication with the members of the team to discuss what the plan is or what things that you need from them, things like that?
Oh, yeah. I mean, we do that all the time. A lot of the simple ones, we talked about doing a couple of hip fractures today. And those, most of the teams, even the teams that are there, we do so many of those that it's very rare that you're like, oh, I need something special. But if you know that you needed something special because the hip fracture was going to be a little bit different or there was going to be something else there, then having that comfort level with your team for them to be able to come and ask you a question, especially if it's a new person who's joining the team. And that's where I think surgeons see things or things happen with surgery a little bit differently than they happen in business. It's not that common for a business leader to walk into a room and have a team that they've never worked with before. But for a surgeon, that's very common, right? You may walk into a room and say, okay, that's why part of the timeout is, does everybody know who they are? So you can address each other by name and you can say when you need things. So it's the first time to meet. Sometimes it's the first time to meet people when you're walking into that room. And so I do think that having that process for communication, especially with your team, is super important, mostly because it establishes the foundation for you to be able to communicate throughout the case.
Sure.
Right. And we've been in those cases too, where it's like, hey, we're about to get started and maybe we didn't do that level of communication that we needed to. I've been guilty of that certainly in the past. And then all of a sudden you realize like, hey, I need this instrument. And now the scrub tech is telling the circulating nurse, and the circulating nurse is leaving the room to go grab the thing. And then I remember, hey, we also need this, which is obviously not here, but the circulating nurse isn't there. So now they're having to run back and forth, and you'll get some substantial eye rolls if you haven't sort of at least packaged those things, because them running out of the OR 20 times, cuts into their ability to do the things they need to do. So I think having that established moment, and part of it's the timeout, right? Part of it's the beginning timeout, which is different from informed consent, but all of it's about communication.
Yeah. Well, and the thing is also communicating to the member of the team the information that's pertinent to what they do. So the way that you're going to pre-talk with our scrub nurse is going to be different than the way you talk with the rep, who you're going to look at imaging with and have a surgical plan with, right?
Sure.
So the way that whenever I was posting the case and talking to the nurse that's setting, that's helping to get that scheduled, is different than the text message I'm sending the rep for the equipment you're going to use, going, hey, we've got this that's coming. We're thinking we're going to need X, Y, and Z products, so that they can have, whether it's that physical person that's there or that they're, again, communicating with their team to make sure, hey, Dr. Piefer's team's already reached out. This is when they're planning to have the surgery, and this is what we need to have over at that facility, as well as, reviewing pertinent imaging or anything with them. So that way they can think, I've seen these go wrong before. I'm going to have these pieces, these plates, these screws, these things as backup in case plan A falls to pieces, which can happen. So that conversation's a lot different than talking to the scrub nurse versus talking to the circulating nurse. It's all relevant to what their role is and how we all come together as a team, right?
And I think that's that informed piece, like being informed. that establishes also a level of comfort in the room and a level of confidence in the room, because that confidence is contagious. If everybody feels like you're sort of flying by the seat of your pants, then there's no easier way to make your team uncomfortable than for them to feel like you don't know what you're doing.
Gotcha. Is there something that you see amongst communication amongst team members that often leads to just like a failure or breakdown of that communication? Like, is there some kind of pattern or theme you've seen which results in people kind of backing away or communication starting to fail?
So, I mean, I think communication fails when people start to lose that comfort. They lose that. So leaders who tend to lash out, leaders who tend to do eye rolls or be quiet, or you know what I mean? Like if you're in those moments and somebody asks a question and clearly you feel like they maybe should know the question, I think taking a moment as a leader to step back and say, okay, are they asking me this question because they're lazy, or are they asking me this question because they really want to know? And I think giving them the benefit of the doubt in those moments, because most people are not lazy, right? Most people are not intentionally trying to hinder your progress or the progress for the patient or the progress for your team. And I think there's a little bit of a temptation, that voice on your shoulder, like, oh, they should know this already. And I think when you get into those spots and you start to make people feel uncomfortable with asking questions, then you also make it uncomfortable for them to act autonomously and to anticipate what you're doing, right? So like if you ridicule somebody for trying to get an instrument ready for you and it's not the right instrument at the right time, right? Then don't be surprised when they don't get any instruments ready for you ever, right? Because there's a simple way to avoid that process, right? Yeah. There's a simple way for me to avoid feeling uncomfortable with you, and that's I'll just wait until you tell me. But you and I both know the best scrub techs and the best scrub nurses who are always have something in their hand ready to anticipate what's coming. They're not always right, but they're always waiting. They're always ready. And you can take a case that takes an hour and a half and you can make it a 50-minute case because they're anticipating and doing the things they need to do. Yeah. And do they get it right 100% of the time? No, but I love to see our team anticipating what's going on and having the comfort level to be able to ask questions and to be able to move forward from that direction. Because if they're engaged and if they're actively participating, then it just makes a huge difference. And that's ultimately better for the team, better for the patient, better for the outcome, less anesthesia. Mm-hmm. You get people going, and then the more that they keep doing that, the better they are in the future. And I mean, now, we have teams that we work with where probably we could go through an entire hip, knee, shoulder replacement without me ever even saying a word, Not that, we still talk, but like, I bet you if we were to sit down with some of our established team, I could probably just stand there and hold my hand out and they could give me each piece of equipment that I needed at the exact moment for the entire case. Right. And at the end, we could all say, let's go,
Mm-hmm. Well, and I would say that, kind of like hearkening back to the question of, are there ways that like communication or faults or things where things break down? One of those is that reactivity, right? And you kind of hinted at that when people, oh, she should know this or you should know this, right? Where we think that up here versus verbalizing it and saying you should know this, or I always use this, or, kind of that immediate reactive need to verbalize. I actually think that sometimes the better choice is to remain silent, right? So if I have that immediate gut reaction of they should already know this, I shouldn't have to tell them. I should, taking a second, thinking about it, and then again coming out with a clear, like, way to let them know of what I'm needing. Right. And a lot of times what you get from especially people who are experienced, and maybe they are checked out a little bit at the moment, or they're just flustered because of other things that are going on, or you've already sent them out of the room 80 times for special pieces of equipment that we don't normally use. And yes, they normally know that you like this type of Yankauer tip, but they asked and you go, and you don't fire off with a, yes, the same one I always use. Right. Or something like that. More of a
the snarky comment.
Right. Being quiet for a second and then just go, Yankauer. And then they're, oh, yeah, I knew that. And then again, you've snuffed the moment out. You communicated what you needed and nobody gets their feelings hurt.
Right. And I think there's the other piece of that communication, which comes after the case, is really the debriefing, right? If you as a surgeon felt like, hey, I felt like you guys could have anticipated better. Mm-hmm. right? Or I felt like there were moments and opportunities for us to anticipate where we could have saved time, we could have established these things. I think that can be presented in a way where really, really good team members and people who want to get better can see that, and where it doesn't happen in the middle of the case. It doesn't happen in a scenario where now all of a sudden you're going to cause your team member to shut down, right? Because if you jump on top of them, right, there's I guarantee you in my career that I've been, when I was a resident or a med student, if you're just going to start yelling, then I'm going to wait for you to tell me exactly where you want me to put my hands and move this retractor. And then instead of becoming an active participant, you're basically another instrument, and you're just like, I'm going to stand here still until he tells me, move this here. Right. And if you don't tell me to move it, then at least I know my hand was in the right place at one point, Right. And I think that part is, it can be valuable to have the skill to not be able to move if you're not anticipating, like if you're checked out and saying, all I'm trying to do is protect myself, I'm in protection mode, then that's not helpful for the team at all. And so that's where the debriefing at the end becomes like, if you really felt like, hey, we've done this case a lot of times, I'd really like for you to go and review your notes and see, and maybe you and I can sit down and we can look at it so that we can be a little bit more, we can make this optimal in terms of the way it goes. I think you're really, really good team members, if especially presented in the right way, your really great team members are going to work for that.
Right. And they're going to be honest with you for feedback too, right? Well, the reason that I was a little distracted and everything during this case is because you asked for some instruments that I'm not used to seeing you need during this case, or I had to leave a lot, or this patient had this unique condition which required me to go, get blood and do what they can, and they can give you that information so it helps you to go, okay, how can we anticipate that in the future? Is there a way we can prepare for that? Or, is this a one-off and we just need to, benign neglect, as we like to say. Watch it and see if it is a pattern that returns.
And I think I agree. And the whole part of the debriefing, and I'm sure we'll talk about debriefing at some point in the future as we get through all these processes. But the whole part of the debriefing is that it starts with your team, right? It doesn't start with the leader just telling everybody what they did wrong and then, okay, have a good day, right? The idea is that it's a two-way street. And if there are moments, and I saw that in residency and in fellowship where people were like, hey, when you called me that name, that was not professional and I'm not going to tolerate it. And there's a moment for that where you can say, okay, you got to make a choice as a leader. Am I going to treat people with respect or not? But if somebody says that and has the comfort that they could speak up and stand up for themselves in those moments, then I think that's actually a sign of a good team that's saying, okay. And then you have an opportunity as a leader to say, okay, I lost my cool, I apologize, or whatever it was.
Right. So kind of on that track, then, let's say you have somebody on your team you would consider them an expert in what they do. They're your scrub tech for the last 15 years, your circulating nurse that's been doing this, or a fellow surgeon or the anesthesiologist, anybody member on that team that you would say is kind of expert level, but a case or a day is not going the way that it typically would, right? That's somebody who probably in their mind has some degree of confidence and knowledge that they know what they're doing. How do you go about communicating with that person when there's been some ineptitudes, failures, or things that didn't go the way that you're hoping? How do you talk to that person who may think that they know better than you do?
Sure. So, I think ultimately it all comes down, number one, it's communication, number two, honesty, and number three, we've talked about willing the good, right? If your foundation of that conversation when people are falling short of your expectations is still on willing the good of the other person, willing the good of the team, and willing the good of your patient, then I think that it's not a very difficult conversation to really have. And ultimately you find out, hey, I got crazy stuff going on at home, I got other things, and you find out that it probably, sometimes people just have an off day, but oftentimes there's some reason for that, and ultimately we're all human beings, right? We're all here to live life, and nobody wants to be miserable, and everybody wants to theoretically everybody wants to help people, right? Everybody wants to make a difference in people's lives, and you have that opportunity. We have this crazy profession where we have an opportunity to change people's lives every single day, multiple times a day. Right. And that part is a blessing. And I think that part is really cool. But I think in those moments when you're having those discussions, if you can found those on love, if you can found that on willing the good of that person, then it becomes very easy. And if it's genuine, right? And if you have gratitude, like, I mean, if you said somebody who was with you for 15 years and they were falling short for one day, right? It's very easy to acknowledge, number one, acknowledge the 15 years that you've had and say, hey, you know, it seemed like something was off today. What was up? And if they're like, oh, I didn't notice it at all, then you can talk about it. And theoretically, you have a relationship with these folks where you can have that discussion. Because that's the part that's the tough part. Like, hey, we've had a relationship for 15 years, but you don't ever tell me anything.
Yeah.
And that's...
Well, I would imagine, like, I mean, at least in my role, it's hard for somebody that not only, like, professionally you care about them, but also, again, willing the good and loving people. It can sometimes be hard to let somebody know, like, they are falling short of the expectations you might have had for them, or what the best way to communicate that while still letting them know they're valued, like, that they have, you know, done a lot that's really great and good, but today or this week or this quarter or whatever, they're not hitting the mark that you know, the metric that you have for them.
And I think it takes a little bit of courage because it's uncomfortable, right? It's uncomfortable as a leader in those moments.
For some leaders.
For some leaders, correct.
Some other leaders, this is where they like chomp down on this. They love like
right. So I will tell you, for me, that's an uncomfortable moment, right? Those are uncomfortable moments because these are people.
That's why I want to talk to you about it.
Yeah.
Because I know what certain personality types would say.
Right. For me, so that takes for me, it takes an active decision, right? Like, it's way easier to just not talk about it and to just move on and be like, they'll be better tomorrow. You know, way easier to do that than it is to actually address it from if somebody who's like me, for sure.
But if you respect that person too, though, then you think about it, and let's say that months go by, a quarter goes by, and metrics are down, numbers are down, things are not good, and then you're like, well, you've been, not as productive. You have not, been doing this. You've not been doing that, and then they find out months later. Right. That's what you've been thinking all along.
Yeah, it's a disservice to them.
Yeah, and that's not a way to love somebody in my mind. That's not a way to will their good. Is to bury something that you're noticing, even if it's minor. You mean come at it with respect and and treat them with the dignity that they've earned, of course. But
and like you said, I'm sure for some people it's very easy because they can can lash out quickly and deal with it and get it over with, and some people who do it skillfully, it probably is amazing for their teams. But I will tell you, for me, not that I probably do. I mean, in terms of like my foundational piece, like avoiding conflict is something that I would say is very, probably, who knows? We could sit down with a psychiatrist who could take me back all the way to childhood, but the reality is if your goal, if you can actively be present in those thoughts, right? If you can recognize what you're thinking, that man, I'm going to avoid this, or man, I don't want to have this conversation. And that probably is an indicator that, I really need to have this conversation, as opposed to just like, I don't want to have this conversation and I'm going.
Right. Well, and again, like if you're the person who's on the other side of that going, I need to have an uncomfortable conversation, but every time in the past when I've brought it to this specific person, this leader, this boss, this doctor, this whoever, they just meet me with, well, the reason this is happening is your fault and here's why, right? That's becomes challenging. Some people are real, like they love finding just something. There's no way that they can give you all positive feedback. They have to do the whole, well, this is where you struggle. You've done this good thing, but this is also not as good as I want. So no, I'm not going to give you what you want.
You get the positive sandwich.
Except the negative.
Negative.
Yeah.
One tiny positive, negative.
Right. Yeah. Like you don't know how good you got it, or you're lucky or whatever. When you're sitting there looking at numbers going, from a numbers standpoint, I've been very productive. I've made a lot of revenue for this company. I've brought in a lot of business. I've, got good reviews. I've got good relationships with everybody. Like it doesn't make sense why all I'm hearing from the superior is negative.
Right.
So
that starts to feel, I think, also manipulative if you're on that side, right? You're like, reality is not jiving with the way that I'm being treated. And that part, if you're a leader and you're going down those roads that you're trying to keep people down, then that's not going to, ultimately you're just going to lose good people.
Yeah, it reminds me very much of, again, like a manipulative, like abusive relationship where, you've got the person like, you don't know how good you got it. most guys would have left by now. That kind of dynamic.
Right.
And then when you finally like go, you know what? I'm going to leave. I'm going to do something different. They're like, why? Why would you leave this?
Yeah.
Like, why would you do that?
Yeah, no doubt.
No.
No doubt. Yeah, I agree. But it all comes down to communication, right? And it all comes down to foundationally still willing the good, right?
Right.
If you can will the good, if you can love people, then, and I think I don't think it's not that it's missing. It's just that it's not maybe that foundational willing the good is not active in people's minds as much, right? And and for some people, I think for some people it's second nature, but for a lot of people you have to, you've got to consciously choose to do that because there is that voice saying like, is everybody out to get you? Like we're delayed for this case. And this happened even yesterday, right? Our first case of the day delayed because we had a contaminated wrap of towels. There was a wrap of towels that had a hair in it, right? And so this is an interesting thought project, right? So there's a wrap of towels that has a hair in it.
Yeah.
Theoretically, that hair was sterilized during the sterilization process. My scrub nurse says, "Hey, there's a hair here, and I don't know what it has touched. I don't know what all has been touched on the table." Right. And so what does she say? We're going to tear down the table. What do I say? Absolutely. But you can imagine if you'd have a relationship where you don't feel that comfort level and they feel like, wait a second, I don't know, what is he going to explode? Is the surgeon going to get really, really angry? We're going to be delayed 30 to 45 minutes because we've got to take down this entire setup and put up a new setup. Andy's on call. Andy's a jerk, all those different things. And then now you make a decision to say, well, I'm sure the hair is fine.
Yeah.
It's fine. And then now you end up, who knows, 2 weeks later, we've got an infected total joint. And so you have to have that environment where people say, like, not only do I believe that the leader is going to will the good of me and my patient, but if I do the right thing, I'm not going to get in trouble for it. I'm not going to get yelled at. I'm not going to get eye rolled, and I'm not going to get blamed, because I feel like this is what's right. And not only feel like it's what's right, but know it's what's right, right? I mean, there really is not a question. Like if somebody's hair is inside of your equipment, you've got to get new equipment in my mind. But where you run the risk is if you don't have that comfort level, if you don't have that team kind of spirit and you don't have that communication, then it's very simple to take that towel and move it over and have that voice in the back of their head telling them like, just avoid the pain, right? Just avoid the pain. Nobody's going to know, right? And then ultimately, something bad could have happened and nobody really knows the reason.
And the sad thing is everybody who's ever worked in the operating room, if you talk to certain personality types, it'd be like, it's fine, just move forward. But then you go, okay, so if that's your mother on the table, you're cool with them having their knee replacement with, that contamination. Oh, no. None of them would be cool with that. Right? Like,
no doubt. Yeah.
And so it's always, again, if it's second nature to you, if it's just part of your process as you treat every patient and every person that you interact with, like they're somebody's mom, sister, wife, then it becomes a lot easier, to make the right decision every time.
Right. And I think that there's an interesting moment because you still hear it when you're a leader, right? You still hear the voice like, oh my gosh, I have so much to do. Now I'm already, like I can look at the next 16 hours and I know I'm already behind. We got cases at multiple hospitals and I'm on call and I've got this. I can't afford to have this hour. But there is a moment where you can actively say, and I mean, I could feel that feeling. But there's also a moment where if you focus on gratitude, if you focus on like, thank goodness she's willing to do that. She was willing to tell me and fix this, right? It makes it just a whole lot easier to be like, man, thanks for doing that. And then you thank them. And the moment that they feel like, hey, I took a bit of a risk here because the surgeon could have just exploded. Hopefully they know I wouldn't do that now, but they could have, And now you're thanking them for doing something which has clearly been an inconvenience to the day, but was not their fault. Anyway, I think, who knows? For me, it's just one of those moments where in that moment when you feel like you could get frustrated, if you can focus on gratitude for doing the right thing, like my team felt good to do the right thing, I think that's nice.
Yeah.
So
I agree.
very good. So should we wrap this episode of Informed Consent?
Wrap it up.
Are you consenting
To ending this episode?
to ending this episode?
Yeah, the motion carries. Let's do
The
it.
motion has carried. The olive, camouflaged olive. I do actually like the olive, by the way. It's nice.
Thanks.
Wait a second. That thanks sounded very familiar.
Thank you is what I believe.
That's true.
phrase.
Thank you for thanking me. All right. Well
No
done.
music. Yeah, just end it. Cut it.
That's good. That was good communication, Taylor. Good communication.